Okay, so good evening, good morning, good afternoon, all the listeners and those that are following us on this webinar. And you are all welcome to our third webinar for the IFSW Africa region. And today our topic for discussion is transformational leadership in the work of an emergency. And in this case, we are focusing on COVID-19 in Africa. So with me, I've got some very interesting panelists. We have the IFSW Africa Regional President, that is Dr. Noah Muridzo. And then we have Honorable Muinjangue. She is the Deputy Minister of Health and Social Services in Namibia. And then we also have Dr. Rory Truel, who is the Secretary General of the International Federation of Social Workers Global. So we have three speakers on the panel today. My name is Joachim Mumba. I'm the moderator, co-moderating with my colleague Anstance Fometu. So we're going to kickstart with our first speaker, who is Dr. Noah Muridzo, the IFSW Africa Regional President. So Noah, over to you. You could start the ball rolling.
Thank you very much, Joachim. Thank you also to your listeners around the world and within our African region that are following our webinars, and specifically this one. We are delighted to be part of this discussion that talks about leadership, and in this time of COVID-19, where leadership is important. We had in the previous webinars the challenges that were being talked about, issues to do with the responses. COVID-19, you would argue, has exposed legacies of leadership gaps in terms of service delivery, in terms of services to people. Because the guidelines, for instance, that were issued talked about distancing, talked about water, talked about washing of hands. And in Africa, you would find that most people had problems in adherence with these because of the different challenges that they had around issues to do with the guidelines and availability of the necessary social services, issues to do with housing, issues to do with water, and also issues to do with livelihoods. And this then showed and exposed legacies of leadership crisis within different countries, but also provided an opportunity for leadership to be shown. What is also very important also that came out is that social workers were now in the forefront. And in some circumstances, you'd find that because of the gaps in the leadership, social workers in other countries was seen as an afterthought. And this also shows to the leadership gaps that were there. But it is also very important also to acknowledge where things were going on right. We had discussions to do and the services being provided and also aiding people and their livelihoods in different countries. So we should also not generalize that there was a leadership gap. Yes, there were issues here and there and pockets of issues, but COVID-19 did expose these two interesting aspects about leadership from different perspectives. But what is also very key and important is social workers as leaders and also associations, how they also came to respond to the various issues that were taking and unfolding. And what is also very key is that to acknowledge that we are still within the storm of COVID-19 and different countries are at different stages of the disease. And leadership will evolve And what is very critical is how then the leadership will then also take into account the different aspects as they evolve in this. So the issue of leadership, Joachim, is very important when we talk about COVID-19, and more so within the African continent in terms of how we then respond and how Africa is responding currently, and how Africa will also see itself beyond COVID-19. And also importantly, that COVID-19, the legacy of COVID-19 will also go beyond what we are experiencing now. So the issue of leadership becomes key as we move on. But most importantly, how the issue of leadership is also tied to social work and social work values and principles. Because we also saw from the previous webinars how issues to do with human rights were an issue, issues to do with corruption. So we can't run away from the subject of leadership when we talk about COVID-19, because as it unfolds, it is also then also exposing leadership as a critical element of what then will be post-COVID-19.
Okay. All right. So thank you so much. Okay, so thank you so much, Noel. Anstas, what is your reflection? Just reflecting on what Noel has highlighted about leadership and the fact that COVID-19 has actually exposed issues to do with leadership in Africa.
Yes, it's very critical at this moment that we have leaders that will pick up a lot of the gaps that COVID has created. Some of the gaps are around understanding the needs of vulnerable people, and also like Noel pointed out, that the thread of empathy it seems to be lacking in some of the responses. There is a quick step up to very kind of punitive type of leadership, and as social workers and how we work ethically, looking at the human rights, we kind of start unpicking those issues. And I'm sure as the conversation picks up, we will be looking at those things in detail. And I think at this moment in time, we would like to also introduce the next speaker, Joachim. So I'll leave that honor to you, because I'm really excited. We've got a woman social worker from Namibia, and she's a politician social worker. So that's really exciting. So I'll leave that to you, Joachim.
It is my honor indeed to introduce Dr. Esther Muinjangue. She's the Honorable Minister of Health and Social Services in Namibia. She's also a social worker with a practice experience of well over 20 years working in the Ministry of Health and Social Services. And her interest and focus has been on family and children. And I think we are looking forward to learning a lot from her in terms of, her leadership, as a woman, and also in terms of her ministry, how they are actually involving social workers also in the response, responding to COVID-19. So Dr. Honorable Muinjangue, I hope I'm pronouncing your names correctly. The floor is all yours. You're welcome. Honorable Muinjangue, are you still there? The mic is mute. Okay, so she's trying to connect again. So whilst we're waiting for her to get through, I think other things that we are looking at in terms of learning, especially from a politician who is also a government official in Namibia, is the holistic approach that the government of Namibia may have taken in terms of responding to COVID-19. Dr. Muinjangue, are you there now? Okay.
I'm here.
All right.
Can you hear me?
Yes, we can hear you. We can also see you.
Yes.
You are welcome.
Oh, thank you so much.
Sure. So please, the floor is yours. You could share with us your leadership experiences as a woman politician. And yeah.
Yeah. Joachim, thank you so much. It's an honor for me also to be part of this panel discussion, especially in this difficult time of the pandemic, COVID-19. Maybe, you know, when we are talking about transformational leadership, what comes to the mind is leadership that can instill change in individuals and also in social systems. It's a leadership that is looking at the future. You have the pandemic. How do you handle the pandemic? But then also after COVID, post-COVID-19, what can we do? Now, for us in Namibia, just even before any case in Namibia was identified, we already have established a national emergency health committee. Now, in that committee, it's where we have one thematic group, which is known as the mental and psychosocial thematic group. That is the group that is now involving social workers, psychologists, you know, community leaders, and so on and so on. And it is in that group where social workers are really playing their role. And I can mention, and I'm proud to mention that, especially during this time, the role of the social workers is really coming out. It's coming out. The first thing that they started to do was, we have people like the homeless in Namibia. And when we started, and with the state of emergency pronunciation and the going into lockdown, the first concern was, what will happen then to those people who are living on the street, living under the bridges and so on? So immediately the social workers started the program for these people. They identified places where they could be accommodated, and the challenge was, but we need to put up temporary shelters. So they went out to the community and they got tents that they put up. And as we speak today, all the people who were living on the streets are now accommodated in temporary structures. And of course, we know that as the pandemic was evolving, it is creating fear in people. People are anxious, people are put in isolation facilities, people are put in quarantine facilities, and the emotions, as you know that as social workers, the emotions are very important. So that was where the social workers came in, and they started to talk to these people, you know, dealing with their emotions and their family members and the relationships also, because if one partner or a parent is in isolation, there are kids out there, and you know, someone need to talk to the kids and put them at ease and all these kind of things. So, and when it comes to leadership, I think also not only the social workers, but our president, we acted very fast. You know, our first case was confirmed on the 14th of March, and 3 or 4 days after that, a state of emergency was declared, and 10 days after that, we went into lockdown. And as we speak now, we still have 16 confirmed cases, of which 14 have recovered, and we have 2 that are still active cases. So the leadership really came out very strong in this case. And in Namibia, the good thing is that it's a holistic approach. It's a multi-sectoral, multidisciplinary, you know, approach to the whole issue of COVID-19. And one good thing is that the Ministry of Information, Technology and Communication, together with the Ministry of Health and Social Services, we launched a COVID-19 communication media center. And that was important because a lot of information started to circulate. And in many cases, this was fake information. So we wanted to have a center where all sectors that are affected could come and share their information with their community. And at that center, the social workers also participated. They were part of the panel discussions to highlight the psychosocial support that they could provide to the people. And also the people who are in quarantine or isolation, before they were put in quarantine, it's necessary to be explained to them why they need to be put in quarantine. And that is the role that is also being carried out by social workers. And of course, before they are being discharged, they also talk to them. And those in isolation are now those who are, COVID-19 positive. So our social workers are also talking to them, the challenge of being isolated from your family members, being alone confined in a room and all this kind of thing. We know what it can do to the mental health of the person. So that is also where the role of the social workers are coming in. And of course, they are already now also putting up a plan, especially post-COVID-19 program as to these people who were on the streets. We don't want to send them back to the streets. So what will happen to them? We already start thinking in that line or direction as well. Do you still want me to continue?
Maybe just in 1 minute, as you conclude your first chance to speak.
Okay. As concluding remarks, the social workers also have been trying to educate the communities. One sector that was also negatively affected is our informal markets. And then they plead to the government for reopening. But before that, education was also provided to them so that they can understand the preventative measures of practicing hand hygiene, washing our hands, social distancing, and all these kind of things. And these were also things where the social workers were involved. The message that we are sending out is always to look at, this is a pandemic, it's a challenge, but what opportunities are there? How can we fertilize these challenges and also translate them into opportunities? And I think we are also very much looking into what could be the opportunities. And we are seeing a lot of opportunities, especially where as Namibians from different sectors, from different ministries are coming together, are collaborating, working with one another. We are really, joining hands, and we are taking each other's hands. And that is the best thing that is happening right now in Namibia.
All right, thank you so much, Honorable, for your encouraging words and also the experiences that you've had in Namibia. Anstance, social work is a human rights profession, and we've seen, I think, in most African countries where lockdowns have been pronounced, I think the enforcement has come so punitive, like those that were found on the other side of the law in terms of the measures that governments had put in place. I think we are faced with a lot of beating and roughing up and stuff like that. So I think as we go on, we may want also to hear how such issues have been taken care of in Namibia. So Anstance, you can take it up.
Yes, and it's really, thank you so much, Honorable Esther Utjiua, elaborate the human side of how COVID can be handled. I think what stands out for me is what you said about communication and how important communication was, and communication with the people in the informal sector, communication at also national level. That sounds like what we were lacking in some of the countries that we've spoken to, where it was very much top down. This is what you're going to do. But the sound of the communication center, central place, and dealing with fake news and narratives about COVID-19, I think that's very unique and different. In some of the parts of Africa, we are relying on WhatsApp groups, on so many different news agencies, and that kind of coming together of all parties, I think it's a very positive thing, and for we would like to hear more about how that is going. And looking to post-COVID-19, you know, whilst the crisis is happening, planning what to come is we would love to hear more of that. And again, it's my pleasure to move to the next speaker, who IFSW should know, and I don't even have to introduce to you who this person is, and I do hope you all know who he is. But again, Joachim, do you want to say who it is? Because that's more exciting if it comes from you.
Okay, thank you so much, Anstance. And our next speaker is Dr. Rory Truell. Dr. Truell is the Secretary General of the International Federation of Social Workers, and he's going to give us the global perspective, and also probably also a reflection on what Honorable Minister has spoken, as well as what the International Federation of Social Workers President for Africa has also said. So Rory, it's all yours.
Okay. Is that working? Thank you. Okay. Well, greetings to everybody, and thank you for the invitation to be on the panel, and thank you also to all the people that are listening in and writing questions and comments. These webinars are hugely successful. I heard just as we were preparing for this webinar that the last African regional webinar had more than 6,000 people participating in it through writing questions on Facebook and on Zoom parties. This is phenomenal. Never before has so many social workers gathered as they are now on these webinars. And it's a way that the profession is supporting itself and facing this challenge. And the profession is facing this challenge in an incredible way. Social workers throughout the world are taking many actions that are saving the lives of countless hundreds of thousands of people. And this webinar is just the continuation of our shared learning and cooperation as we move forward and strengthen the profession and support the communities that we serve as we go forward. So thanks for the opportunity to participate in your regional conference webinar. I want to take the opportunity just to reflect on three issues. I want to actually first of all not talk about transformational leadership. I'll come to that. I first of all want to talk about the impact that the African regional social work is having on the globe, on the world. I then want to talk about the voice of social workers in Africa for the indigenization of social work and the impact that that is having on global social work. And then I want to come back and return to the theme, if you allow me to do that. So just to first of all talk about the impact that African social work is having on social work globally. Social work in Africa has shown itself to be marked by the support of informal systems in communities and in families. And the many examples from each and every African country show a focus on strengthening communities and families to be able to lead their own development, and a focus on building those informal support systems at a community and family level. This is not the practice throughout the world. There are many different forms of social work that are shaped by political systems and by different bureaucracies and resources. And social workers throughout the world are working in different ways, in very positive ways. But particularly from Africa is the sense of recognizing the strength that sits in communities. And all of your examples have helped shape discussion and learning across the globe. So one example that's been particularly of interest to other regions is the role that's occurred in many African countries of developing child protection committees within a community. So in the absence of a country without strong state services or strong legislation that protects children, that the social workers are facilitating the community to be able to come together and to think about what is the best way that they can protect their children, and to nominate or step forward for people, for members of that community to nominate and step forward and say they are going to set a plan in that community to protect all the children in that community. And they monitor it and they manage it, and it has a huge success rate. And so this work is supported and facilitated by social workers that recognise in what we call informal, because they're not state services, but they're systems of protection, social protection. And so, so globally, we're learning an awful lot. We're learning that in the African context, there's a sense of preserving culture and extending culture, not trying to import other cultural models from outside of your region, learning from those, but being able to make sure that you preserve and extend the culture of your people, so that the people in the communities can stand tall and they can say that their culture is equal to every other culture in this world, that their language is equal to every other language in this world, even if it's spoken in this province. So I think that helps the communities to have confidence and vision, as the Minister spoke about before. Leadership is about vision. And a part of our role as social workers is helping communities to develop those leadership skills, so that the communities are leading their own development. They're confident, they're modeling it to their children, they're including the people in their community as they move forward. And the social workers are there behind the scenes sometimes, and sometimes in front of those meetings, always constantly supporting that. The other aspect of the way social work unfolds in Africa as we observe it from outside of Africa is the focus on the multidimensional issues of poverty. So in some countries, social work has been divided into fields of practice, in some regions, divided into fields of practice. And fields of practice are important in the sense that we need to have specialist skills in some areas. We need to have specialist skills in mental health. We need to have specialist skills in physical health. All the places that working with the elderly, all the places that social workers work. But in Africa, there's been a stronger consolidation of the social worker working on a much more multidimensional context, looking at the economic capacity of the community that you're working with, looking at food and water security within the community and how the community can play a role in that, looking at the skills and education, not of just the children, but of all the generations, looking at the capacity for the community to be able to advocate for itself. So looking at all of these multidimensional factors, all of this is having a positive aspect on the global profession. It's like a gift from Africa. And so I just wanted to take this opportunity at the start of my comments just to say thank you to the African region. Thank you to all the social workers in Africa who are modelling this and demonstrating this. We're learning a lot from outside of your region. That kind of brings me to the next point about indigenisation. And every time I've had the opportunity to come to meetings and to come to frontline services in some of the African countries, indigenisation is a hot topic, and I think that's so important. There are incredible examples of the way social work and Indigenous culture come together. One of those examples that really has impressed me, and there are many examples, but one of those I just want to refer to today is from Rwanda. And following the genocide in Rwanda, as a society and as a country wanted to rebuild and bring people together, bring divided people together from a context of genocide to a context of unity. This was no easy task, no easy task at all. This was a task of people who had lived together and together side by side, and then a genocide happened between those two peoples. And the social workers had a strong role to play in moving from a situation of absolute distrust and absolute fear to a position where people were working together. They advanced and they supported the government to be able to bring in something called the 1 cow per family policy in Rwanda. And for you in Africa, you know the conditions of Rwanda. For people watching this video outside of Africa, they may not know, but we're talking about people who live in rural villages and subsistence living. And so there's poverty issues on top of the genocide issues, on top of the colonialization, colonial issues, multiple layers of problems. But what the social workers advocated for, advanced and the government supported and took forward with this policy called 1 cow per family policy, is that the government would issue every poor family with a cow. That cow represented many, many things to that family. It represented fertilizer for the fields. It represented milk. It represented beef. It represented status within the community. And so from a start, when the government started to issue every family with a cow, there was a sense of equality amongst all people. It was a system of creating an equal environment between people that had been in a blood situation to people moving beyond that. A vision, as our minister said, a forward-thinking vision of leadership. And not only that, but the firstborn calf of that cow had to be given to your neighbour. And that neighbour had to give that firstborn calf of their cow to their neighbour. And ever since this was introduced, these villages are swapping cows all the time, and they have to form a relationship around this. This has been a huge successful factor in overcoming the absolutely catastrophic genocide. And social workers have been there, and they've been advancing that and delivering that and supporting that. They tell me in Rwanda, this is an indigenous model of social work. It's an ancient tribal system where chiefs used to use pre-colonial times, a system to bring peace between warring parties or people in conflict. And so this is a wonderful, wonderful example that the world can learn from, and there are many. I guess my time's coming up, so I'll move now to transformational leadership in an emergency. I want to say that all social workers are transformational leaders. If you don't get the opportunity as a social worker to practice as a transformational leader, it's probably because your job description doesn't recognise it, or the policy domain doesn't recognise it, or your employer doesn't recognise it. But your profession recognises it. All social workers are transformational leaders because our job is not to provide aid. We do that, but our job does not stop there. Our job is to change the circumstances and to influence and support people changing their own circumstances in order to make change in their life, transformational change in their life. 1 cow policy example is part of that. The other example I talked about before was setting up community committees to protect their children is another example of that. We know as social workers that when our job is complete, the people that we've worked with feel confident, they feel strong, they feel able, they're able to articulate a vision for themselves, and they're able to act on it. All of the skills that sit behind that. Our job is to work with them, to support them, to identify that they had those skills. So I saw George Mansarai from Sierra Leone talking a couple of weeks ago. And that's exactly the approach that he said. We know how to fight the COVID-19 virus, he would say, in the communities that were feeling very fearful of it because we've dealt with Ebola. We know about social distancing or physical distancing. We know how to manufacture soap. We know how to, we know how to start to not have to pay to import products, how to develop them ourselves. And so this example kind of captures all the things I said before. It's an indigenous model. It's a strengths-based model. It's a community model. It's a model of building those social systems. And what George and what social workers across your region are doing is, by supporting people to lead their own development and have the confidence, is actually asking them, inviting them into a context where they are the transformational leaders. Our job is to help facilitate that. And I think that's missing in some of the policies that we have as a profession. I think that's missing in some of the ways we understand social work in other countries, where social work in other regions has been formed by policy out of a political spectrum of divide and creating great bureaucracies that social workers have to battle with. And so there's this exchange, this learning that we're having now will help social workers in this context of change, in this context of COVID-19, where everything is shaken up, to be able to help advance the idea that every society needs social workers to be able to work with communities so that the policies are shaped by communities' involvement, so that the vulnerable people, the homeless people, the people who are living in poverty have a say in how those policies are shaped and developed. And they're engaged with the process, and they can start to lead and change from within their own communities. So those are just my opening remarks. I've probably taken the time for all of my remarks. That I'll pass over to the next opportunity for someone else to speak. Thanks so much.
Thank you so much, Rory. It's just nice to reflect on particularly what you talked about in terms of community child protection workers and volunteers. Most of them are unpaid, and they are working right in the thick of it. They are dealing with domestic violence issues, sexual abuse, and they're the referral point for a lot of the children. And most of the children in those communities, and we heard it from Malawi, we heard from some of our colleagues in Nigeria, and even in Senegal. We hear a lot of child protection workers are volunteers and trained by social workers, and you know, one of the statistics I know for sure in Malawi is a district of children, the number of children is over 400,000, and there's only 9 social workers. So those are the gaps that you know, child protection workers may not be trained as social workers, but they're filling in a very critical part, and that is a good model, like you pointed out, and it's embedded in the community, so those children know where to go, they know the language that they need to use. You also spoke about the importance of indigenization, and some of the traditions in Africa are embedded in protecting the most vulnerable children, the most vulnerable adults, the people who have complex mental health needs, the people with disability. And we need to reinforce those institutions and recognize them as part of the social protection fabric of different parts of our communities in different parts of Africa. And it's important to also recognize the churches, the mosques, and other spiritual leaders, that they are also part of the fabric of protecting our children, as well as the most vulnerable adults that are found in the community. I would just like to take this opportunity to thank some of our colleagues who are watching us. A big thank you to Silvana. I can see Silvana Martinez is watching us from South America. She's our global president for IFSW. And we have some of our colleagues from Senegal, from Morocco, from Israel, from Guatemala, from Canada, from India, from China. You know, it's just nice to work and walk during this time in solidarity with all our colleagues around the world, and the ability to learn from each other. I think that's really important for the development of social work, and for us social workers in Africa to learn from each other. At this point in time, I would like to go back to Noel. And Noel, you have heard what the Honorable Minister from Namibia, Esther Utjiua, just said, and also what Rory just said. What do you take from what has been shared so far?
Thank you very much. Let me start with what Rory said and shared. Critical is social work in Africa, where issues to do with community and family and the focus being on participation of people is key. What is also key is Africa expressing itself, and as in Africa express themselves, bringing African solutions to African challenges, but also going beyond in sharing that with the rest of the world. But also key, from what Rory was also saying, is the issue of social work by its nature being transformational in itself, in harnessing in harnessing participant community engagement, solving their own lived experiences and challenges. So that is also very key. He also highlighted some of the examples that he shared. From the minister, we also confirmed the presentation that was done in the previous webinar, what is happening in Namibia and how the government has responded. But what is also key is issues to do with leadership post-COVID-19, and also the role of social workers as leaders as themselves, in terms of, if you look at the issues around transformational leadership and how it also tries to harness participation and also community involvement, and how social workers can also use these and are using this. So it is key in terms of how we move out of COVID-19. Critical is the role of social workers in all this, and the leadership that social work has shown in Africa through the various associations, through social workers as individuals. So the leadership that we are talking about in terms of what social work has done and is contributing in terms of leadership is at various levels. You look at social workers by their nature individually and the nature of their job. They do promote leadership and show leadership. But we have also seen leadership in terms of social workers in various roles. You'd also appreciate that the minister who is part of this panel is also in her right a social worker, but also occupying a leadership position in a country. So you do find social workers in different leadership roles. But also to mention that leadership in terms of associations and to social workers as groups coming up with a voice that Africa is connecting not only to their governments, but also projecting to the world and sharing their experiences to the world. So these are some takes that I took, instance, from the presentations that the former speakers made.
Thank you so much, Noel. I think I will go back to Minister Dr. Esther Utjiua. You know, one of the things that we are quite curious about you is that you also are the opposition leader in Namibia, which is quite an unusual place to be. But it also shows the kind of the dichotomy of social work, where you still have to work with the people you are opposing, but work alongside. You know, it's almost like we don't agree with your behavior, but we work alongside with you for change. How do you manage being an opposition leader as well as a minister within the government, and having your values, your social work values, you must have a bit of conflict there as a leader. How do you manage that?
All right, thank you very much for that question. It is true that I am the president of an opposition party, and I should mention that for the first time in Namibia, I was elected the first female president of a political party. And it's true that it's unusual, it's uncommon, but it's not something new in Namibia, because I can recall that immediately after independence, we also had 2-3 people from opposition parties who were also serving in the Namibian government. And maybe this is a good demonstration of the democracy that we are talking about in Namibia. Of course, being a social worker, we know that we have some few values that we appreciate. Is the value of communication, the value of honesty, and so on. So for me, it's not a challenge. It's not something difficult to be in the position that I am now, because for me, I was given a platform. I was given an opportunity where I can serve the Namibians. So being in this position as a member of an opposition party, I'm not looking at it as, and that has been my campaign message also, that I will not go to parliament to oppose, but I'm going there to make use of that opportunity to serve the Namibians, to deal with issues that are affecting women and the girl child. So it's an opportunity that I'm using. And of course, if there are challenges that I have not picked up at this particular moment, since I have moved into in office, but I'm looking at the positive side of it, of how can my social work experience and expertise be applied to benefit the Namibians. Because we don't need to belong to the same political parties to work together, to collaborate. When you are in the National Assembly, you become, although you go there on a party ticket, you become a national leader. And that is what I'm focusing on, looking at how can we restore the dignity of the Namibians by using the opportunity that I got from the president of Namibia. So it's a good demonstration of the democracy in Namibia.
Okay, so Honorable Minister, post COVID-19, as a leader, what role do you see in terms of the need for reconstruction and other things that need to come with post COVID-19? What role do you see the social workers play?
Yes.
And also in terms of permanent solutions for those people that have been withdrawn from the streets, you mentioned that they are in temporal structures. So are there any permanent solutions that you are looking at? And also, yes, maybe my last is whether you'll be willing also, for the sake of our region, Africa region, to be the champion for our profession, because we see that in most countries in Africa, really social workers are not being recognized. And even in responding to COVID-19, we are emphasizing so much on the medical aspect of the pandemic than the social aspect of the pandemic. So how would you come in to influence other leaders in Africa?
Yes, thank you very much. Maybe I should start with your last question, Joachim. We have been emphasizing that as much as the pandemic is a health medical issue, it is also a mental issue because of the fear, the anxiety, the unknown that it is causing. And of course, we should also not forget the issue of discrimination and stigmatization. We have experienced that also in Namibia. As much as we have less cases, we know of some few incidents where people were stigmatized, discriminated against. And again, that was the role of the social workers, to go into their communities and to educate people on that as well. So as my previous speakers also mentioned, social workers are change agents. So they are there to transform communities, to transform individuals and societies. And at the moment, they are relying more on the person-centered approach, as well as a strength-based perspective, where we are not planning things for the communities. We are not, drawing up programs, but we hear from the narratives, the voices, and especially the voices of those people who are now at the moment put up in temporary shelter and accommodation. These are people that we believe they have potential. And as social workers, it is our role to unlock that potential, to help these people also to develop their undeveloped skills and opportunities. And so they have meetings that they have with these people, hearing from them as to how do they see the future post-COVID-19, so that we as a government and as social workers in government are not just coming up and impose programs on people. So they are, and I can tell you that since we have started with the state of emergency, our social workers are on the ground. 24 hours, they are at those areas where people are. And they talk to people, and they have helped the communities also to come up with a task force or a committee that is also meeting with the social workers, so that they can tell the social workers as to what is it that we want to see happening after COVID-19. So that is a very important role that the social workers are playing in enhancing the problem-solving skills of the communities by involving them, make them part of the agenda so that they can tell what is it that we want to do. And of course, what is also important is that it's a down-top approach where the communities themselves are narrating on what they want. And besides the media center that I referred to earlier on the COVID-19, we also have a toll-free number of the Ministry of Health and Social Services, which is 24/7, and people are calling in. And as they call in, they have queries on issues that relate to the pandemic, but they also come up with solutions and proposals that our social workers are tapping in to see what can we do to assist the communities, because we are saying, the social workers are saying that post-COVID-19, we don't want to see Namibians going back under the breaches, going back into the streets, but we want to have them, help them have a dignified way of living. And that is very important because, as I mentioned earlier on also, the social workers already with other stakeholders have already started to look into what is it that can be put in place, especially after COVID-19. We have different ministries like the Ministry of Rural Development, the City of Windhoek, the local municipalities, the regional councillors. They are all part of this team. And of course, the last question on whether I will be willing to be the champion, of course I would be willing to, because social work, it's a what do they say? It's a profession with different or many faces. People always look at social work as you are providing counseling, you help people and so on. It's more than that. It's more than that because it's a human rights profession. So we have different roles that we are playing as social workers, advocating on behalf of those who cannot, speak for themselves, helping them to raise their voices so that they can be heard. So we have a lot to do. And the other day I was talking to one social worker who said that you know, as much as we look at this COVID-19 as a challenge, it is really also creating opportunities, because now more and more people are becoming aware of the role that social workers can play in the country. And as one speaker also said that in governments, you know, the role of social workers is not highly appreciated. It's not really coming out. It's being seen as a, you know, it's a charity service that we provide to organize. But we can also influence policies, because the policies are impacting on the livelihood of our communities. And there we can also play a role and influence the policies that the government is bringing up. And that is why I'm also very thankful to be in this position, being a lawmaker as member of parliament. That will also help me to influence laws and bills that are coming that might also influence the work and the operation of social workers.
Thank you so much. Thank you so much again, Honorable Utjiua. That is really important. One of the things I take from what you've said is the voice of the community, the people themselves who are experiencing what we are doing and how we respond to them. It's not just us doing to them, but them telling us, because they are the experts. They are the ones that are living that experience, and to hear their solution, because they know what needs to be done. Whatever I've read in my books has no bearing for someone's lived experience, and I should be able to learn from them and to hear what solutions they have. And social workers, like you're saying, are facilitators of that change. And like Rory say, that we are leaders, all of us as social workers, in leading by hearing, by almost leadership, by servanthood type leadership, where we hear what the service users or the communities want, then we do, and we walk alongside them. I think I'll come back to you, Rory, on that. One of the questions we've had through is that how can one be an effective social work leader, especially where you've got a lot of youth thinking about coming into social work? How can you speak to them, how they can become, you know, transformational leaders? So lots of youths in Africa, lots of social workers who probably work in a very top-down environment. Speak to them, Rory.
Well, thanks again. Look, I've got to make a comment about the wonderful comments that Minister Esther Utjiua has been making. Don't we all just wish all of our governments would have a Minister Esther Utjiua? This is a really wonderful demonstration of social work and political leadership. And wherever social workers in any country have risen to the political level of representation in a government, human rights get realised, people advance, the economy gets built, the life becomes more peaceful, sustainability takes place, and social workers should not be shy of taking their experience, their learning from the profession and taking that to the political arena. And we have just such a wonderful role model with us today. We have other wonderful role models in other places in the world and lots of history. We've had entire national health systems be built under the leadership of social work leaders in politics. Many, many examples. Look, coming back to your question, all social workers are transformational leaders, as we said before. It's an obligation of the profession. It's what we signed up to do. Doctors signed up to save people's lives. Engineers signed up to make bridges safe and make roads safe. We signed up to support people's social conditions. That's our obligation. And if that's not reflected in your job description and in your workplace, that's an issue that you need to advance with your colleagues, with your profession, and with the people that use the services. That's a part of the transformation process. We need social work to be recognised as a profession in the way that doctors are recognised as a profession. Now, it might be that some people listening hear, oh, I've got to be a transformational leader, but I don't have the confidence. I have to develop my confidence first. I don't think you do. I think our confidence comes as we step into this journey. We don't have to be whole before we become a transformational leader. What we have to have, and we must have, is a vision. A vision where people make decisions that support each other. A vision where communities are looking after each other. A vision where people are included in society and can contribute. As the Minister beautifully phrased before, where a vision where the potential of people is unlocked. So if we can have that vision and apply that in our work, our journey in our own right as a people, as humans, our journey in playing a part in facilitating that as social workers, that's the process in my experience that makes us whole. You don't need to start by being a confident, articulate leader. You just need to start. And it's wonderful that there are so many young people coming into this profession. Never before has there been so much social work training throughout the world. And you don't need to follow the way things have been done. Every single generation has the opportunity to interpret the principles and apply them in a new way. Just as every single generation in a community needs to look back at the wisdom of the past and know how to translate that as it moves forward. That's exactly the same as social work. Your voices are needed, as you are also needed in every society. We know that when social workers are in a country, not just at the political level, but at the community level, crime rates go down, hospital admissions go down, domestic violence goes down. So if the question is, what's my advice to young social workers coming into this profession, is find the vision. Make it meaningful to yourself. Make it meaningful to the environment around you. Believe in people. Believe in the communities. You know, the world has just experienced something phenomenal. People in every country, almost all people, have complied or agreed to the lockdown situation. People want to have a future. People want their neighbours themselves to be healthy. People will make sacrifices, and people will express solidarity. People will police their own communities if someone isn't adhering to the lockdown. There have been exceptions, of course, but by and large, when people have the information they need, they make the right decisions for themselves and for the other people around them. And I think that's such a fundamental part of social work, is the belief in people. When you give them the information, they make the right decisions. And as our Minister has, in our panel today, has said so eloquently, it needs to be a bottom-up approach, and that's our job. And that's our job as social workers, and that's our vision and our mission. And I think if you've got that, you will be an incredibly effective transformational leader.
Okay, thank you so much, Roddy, for that. Those reflections. Noel, I'm just putting you on the spot. I know you are my president, and probably putting you on the spot. So what can we learn from you, Noel, in terms of your leadership style?
As you say, you are putting me on the spot. And I feel that that would have been a question that you would ask other people, or maybe the vice president, to say, what can we learn from Noel being the president? But what I will just say is that I have not taken myself as a leader, but taken myself as a person who has been given a mandate by Africa to pursue. And always also being shaped by being a social worker. My role is to articulate the African voice on the global arena and of social workers and national associations. As the other speakers have said, that by its nature, social work is a leader as a profession. So my role also is to articulate and to harness the voices of social workers, and in particular associations which are members of IFSW onto the global arena. And to say whatever we have done over the past 4 years, for instance, the conferences, the webinars and other things, it's not me. It's when you see me, it's a group of other people around me. And maybe the idea of getting and trying to get the ideas from everyone to say, how do we move as a region? So I wouldn't say I have a leadership style. Maybe that's a question you could ask the other presidents in Africa in terms of that the style that I take. But I would say that it has been the associations that we have been working for, and not working with or working or leading. We have tried to harness the African voice. I'm very happy that we are having this discussion on leadership in terms of what it means for social work. And from the discussion that we have, we do find that social work by its nature is leadership, and the issue of participation of not only the associations, but also participation of the social work practitioners themselves. I think you would appreciate that has been key in all the discussions that we've been saying, to say, how also do we take social work to the practitioner and the voice of the practitioner and the association to global? And also, how else do we take the voices of the people that are in Africa to global? So it is quite interesting and fitting that we are talking about leadership and participative leadership, and how this has been critical in this time of COVID-19. But more importantly, also, as the minister has been saying and Rory has been saying, is to say the leadership role that social work has going forward post-COVID-19. And I also would want to encourage governments to actually see the benefit that they can derive from working with social workers, given their leadership role that they have and ability to even make a difference in COVID-19 and post-COVID-19, and also to learn from the mistakes that as leaders and as Africa we had done. Because you look at the deficits that I was talking about and the gaps, this was also a time to learn how not to, but we also learned how to, and also to say for leaders to take the initiative, but also for associations and social workers to take the leadership role where others politically do not see the role, to take the initiative ourselves, as Rory has been saying, to take the leadership role in transforming. And I know that social workers in Africa have been doing that. You have so many activities that are happening within the African region because, as Rory was saying, it is in our DNA to harness people's participation and to communicate with people, and to harness people's own solutions to their problems. So social workers by nature have abilities for social workers to take that. Thank you.
All right, thank you so much for that. And I just want to say that online, Silvana says, yes, agrees with you, Honorable Minister. Silvana is the global president, saying that social workers are political leaders and they should be united and a united voice is a very powerful voice. That's her comment online. There are so many wonderful comments agreeing with what all the speakers are saying. At this moment in time, Rita, I want to ask you, Honorable Minister, I'll ask almost 3 questions, but you can mash them up into one. I would like to know what values are important to you as a leader, and also there is growing evidence that women in leadership roles at the moment have improved a lot of positive outcomes during the COVID-19. We have seen lots of good examples. We have also seen some poor examples of leadership among women, but a lot of the women have stepped up. What is it, in your opinion, is behind that sort of success in dealing with a crisis as you know, as we see the future now? How much involvement should women be in times of crisis? The last part is really, who is your favorite leader and why is that person important to you? So would like to know a little bit more about those issues, if you may, please.
All right, thank you very much, Anastasia. We are talking about a crisis, we are talking about pandemic, and women now coming out in their leadership roles being emphasized. Now I want to go back to the homes. Who are the leaders in homes? You know, it's not men. These are women. You know, men are the heads of the homes, but who is, you know, keeping that home? Who is creating that environment for everyone in that house? So men are the 21st century is the era of women now. You know, we see women, for example, we see more young women coming, you know, a number of the students are.
Unfortunately, we are losing the connection with the minister. I will just pause there whilst we wait for a better connection. If we are you back, Honorable Minister?
Yes, connection. Yeah.
Okay, we've lost the connection. Rory, I'll come to you. Who is your favorite leader, and why do you feel inspired by that person?
Well, just reflecting on what the minister, where she was going about women being the leaders in the house, and I was just thinking of the way I grew up, and my father always drove the car, but my mother always said how fast and where to go. And so that's my personal reflection on her comment that she was starting to make. Look, my favourite political leader is someone in our generation, someone from your region, and that would be Nelson Mandela. Nelson Mandela wasn't a social worker, he was a lawyer. But Nelson Mandela got married twice in his life, and he married social workers on both occasions. And I'm sure that's because the values that he had resonated with social work. My favourite quote from Nelson Mandela is that good leaders don't seek consensus. Good leaders shape consensus. And I've learned a lot, and I think we've all learned a lot from that quote. Our job when we're working with a family, and a family that's in conflict, is to try and shape consensus and understanding between them. Our work in a community, our work in our workplaces is about trying to shape consensus and balance rights so that everybody is recognised. So for me, I find that a very personally motivating quote from Nelson Mandela. Who are my heroes of social work? There are many, many of them. And I had the opportunity, I'm very lucky to meet many social workers in my role. They tend to be men and women in their 40s and 50s and 60s. They've got lines on their faces. They don't dress in suits. They dress pretty casual. The lines on their faces tell stories. They're social workers that have been in practice for 20 to 30 years. They've seen every kind of unimaginable thing. They've seen every kind of abuse that humans can inflict on each other. They've seen people move from states of absolute trauma and grief into changing the world around them. They've got this incredible confidence that when you're around these social workers, you just feel trust, you feel solid. And these are my social work heroes that are transformational leaders. They're in Africa, they're throughout Africa. I've met them in South Africa and Zambia, I've met them in Ghana, I've met them in Uganda, I've met them in Rwanda, I've met them in the northern countries of Africa, and Morocco and Egypt. I've met them in the Middle East, I've met them in India, I've met them in Latin America, I've met them in the United States, I've met them in England. The social workers who have that 20 years of experience behind them, they're phenomenal. They motivate me. And what they do is they understand it's not about them. They understand that. They understand it's about people working together, as Nelson Mandela had stressed in that quote, and shaping consensus between divided people so that they can move forward together as one. So that's my answer.
Thank you very much, Rory. Honorable Minister, I'll come back to you to just pick up on where you stopped from. We lost you for a little while. So if you could tell us your favorite leader and why, and you were talking something really important about women in the home and where the leadership is. And I'll just add this, that when you started saying the men is the head, I always say the women are the neck. They tell where the head where to go.
Yes, yes.
So you pick it up from there.
Yes, because I just want to use a very practical, traditional example in Namibia. For example, you go into our villages. Children will tell their fathers that the school is about to start. I have no shoes. The father will say, yes, I'm hearing what you are saying, so it's fine. Why? He's waiting for the woman. Because when they are in their bedroom now, he will then communicate to the wife and say, you know, the child said he doesn't have shoes and so on. The wife is the one who would say, so why are we not selling that one kettle or that calf or from that kettle so that we can have money and buy? And the next day the father will tell the child that, so now you can have your shoes. So who is taking the decision? Is the woman. So, and I want women also now to start moving outside. You know, we must start now crossing the borders. You know, we have been doing things that the community have been telling us to do. And we have been internalizing that. And we were kept behind. So it's time for women to start coming up and you know, take their rightful place in societies, in leadership structures and so on. Coming to my role models, there are so many, because from each person, you learn something, you copy good qualities that you see in that person. When I started to join politics, I always used to quote Indira Gandhi, because apparently people were used, you know, they used to call her or to refer to her as the political woman, the political woman. And then she told them that I'm not a political woman. I am a politician who happens to be a woman. So that I like that one. And Rory just also mentioned Nelson Mandela is one of my role models for the simple reason that when he came out of prison, you know, everyone expected that he will behave differently. He will have, you know, revenge and so on. But for him, it was, well, let's take it from here and build a South Africa for all who are living in South Africa. So he could forgive, and he could, stretch his hand and say, let's forgive one another and see how we can take South Africa from here and move into the future. I like that. And of course, Winnie Mandela was one of my favorites as well, because not only that people are saying we look alike, but I also saw, I saw some, similarities, being women, being social workers, being active in politics. And of course, back home, there is one social worker. Her name is Dr. Hetty Rose Juniors. She was my lecturer. And then we started to work together at the University of Namibia. And what struck me most from her is that she was once a local councillor in the city of Windhoek municipality. And that told me that, okay, so social workers are not only councillors and, helping people and so on, but we can also play a role at other different levels. And that also influenced me a lot to motivate me, to inspire me to move more into politics and to start showing more interest into politics. So, and as I said earlier on, social workers are the change agents. We need to start believing in ourselves, and we don't need to shy away. We don't need to look at social work as inferior to other professions, not at all, because I haven't seen a profession where people are so multi-skilled than in social work. You can put us wherever, we will manage that situation.
Thank you. Thank you so much, Honorable Minister. Joachim.
I think it's time for women to come out of the kitchen, and I think that's what I'm hearing, that women are not only supposed to be in the kitchen, but they need to take up leadership roles. I think as men, we need to occupy the kitchen now. We need to exchange the roles that society has prescribed. Coming to Noel, I think it's the same question. Who is your role model in terms of the leader? And I would love you to talk about Africa, the leader in Africa.
Thank you very much. When you talk about leaders in Africa, then you narrow the description of people who can be inspiring. But like the former speakers have said, you would find that different leaders would have different qualities that you take, and they have their weaknesses. So you tend to look at it from that direction. Yes, of course, Mandela is a person who has left a mark, or not only on Africa, but also on individuals and even beyond. So you would also look at that. You have also narrowed the leaders that I look up to, because you said in Africa. In Africa, we tend to have a mixture of characters and sometimes extremes. So you then find it becomes limited, and sometimes you then get leaders when they start, they are sincere, and later on they become polluted, and you miss the whole. So it does limit in terms of the leaders, because you have narrowed it down. But I have also had the privilege also of not only having leaders from a political viewpoint. I have also worked and interacted with different leaders of associations who have also been there, and also inspiring in terms of their work, social workers in their own right. I've also had the privilege of working with Charles Mbugua as the president for Africa region. I've worked with Daniel, and I've learned also a lot from them. So you would find that you also get inspiration, and also passing on the baton from these guys as you learn. But also importantly, as the minister has said, We have also interacted with women leaders who have also inspired us, not only in social work, but also beyond. So what I would say in terms of any favorite, I don't have a specific, but to say I have people who have contributed different qualities that you say, I've learned this, and also to say what's also important, also from those that we do not aspire to be, we also learn how not to, which is also very important. So those who are also bad apples, we also learn from them.
Thank you so much, Noel. So I think I'll make a round in terms of the last words. I think starting with Honorable Minister, what would be your last message to the followers and the listeners, maybe under 1 minute?
All right, thank you very much, Joachim. I just want to commend and applaud social workers out there for all the good work that they are doing. And as I said, we should not underestimate ourselves. We can contribute, we can make contributions. We are leaders in our own ways. And the most important thing is we need to find ways to market our profession. That is very, very important, because at the moment, the experience here in Namibia is that as a social worker, you are happy helping a family there or helping an individual there. But we are not really publishing, we are not writing our stories, and we have a lot of nice indigenous stories that we can share with the rest of the world. So it's time for us to stand up as social workers, to market our profession, and you know, to feel all the various levels of the society with our knowledge, because we are really knowledgeable, and we have the skills, we have the expertise. And so I wish them all the best, especially during this pandemic, COVID-19, and you know, ask them to keep on continue the good work that they are doing. And take care of themselves, because self-care is also very important. We know that professional fatigue, burnout can easily, you know, step in, especially during this time that we are caring about other people and forgetting about ourselves. Thank you.
Indeed, thank you so much. We need to start telling our stories. We need to start documenting. In fact, even as we are having these webinars, we started the first, I think 3 weeks ago or so. We are actually documenting everything through this conversation. And I think we are going to continue doing so. And we encourage our colleagues, social workers in Africa, to tell their stories so that the world can learn what social workers are doing. Rory, your last words under 1 minute.
Okay, thank you. Look, I concur with what the Minister has said. It was a very good message. I'll just add a couple of remarks. Don't forget, if you're a social worker working in an NGO or working in the government, don't forget, you are not alone. You have your national association and you have your international federation behind you. If you're feeling alone, reach out to those networks. Reach out. We all need networks. Nobody can survive and do this job by themselves. It's just not possible. We need to be a part of a team and a supportive team. Find your colleagues around you and find your national association. They're there for you. They'll be delighted to hear from you if you're not already in contact with them. Don't forget also that the world needs social workers. Without social workers, things are much harder to change. Human rights are very rarely offered by a government. There might be an exceptional government, but most often in all parts of the world, human rights are achieved through people demanding them, through communities demanding them. And that's where social workers are so important. Social workers help people to realize that they have human rights and that they can be advanced. That is such an important part of the defense of human rights and the sustainability of the future. So don't forget, you're not alone, and don't forget how important your job is. Thank you so much.
Thank you so much, Rory. My President, Noel, your last words. I'll not say under 1 minute, probably 2 minutes or so.
Joachim, it will be, I hope, under 1 minute. Just to say, social workers by themselves and the nature of the profession are leaders at different levels. And we would want to appreciate social workers in Africa, and also to say, as the Secretary General has said, we are there for support, and we encourage you to participate in country and make your contributions, make your voice be heard. This platform that has been afforded to us by IFSW is one way we have tried to harness the voices of African social workers to the world, but also most importantly to social workers in Africa, and also to share our experiences. I was just listening to what the minister was saying, and to say, I think she had a preview of certain information, because I know you'll make an announcement on the next webinar, which then will also answer some of the issues that have been coming up. But also to say to social workers in Africa, you are not alone. Stay safe, protect yourselves, protect your families. Hashtag Africa Respond, hashtag IFSW Responds. Thank you very much. You are appreciated. Share your stories, stay safe, and thank you.
Thank you. Thank you very much.
Thank you so much. Thank you so much, Noel. Anstance?
Yes, it's really a pleasure to hear the encouraging words to social workers on the ground, and what we take from this leadership conversation is that communication is really important, but each one of us is a leader where we are. If we choose to support or help somebody next to us, we become leaders. But the most important leaders in what we've heard in this conversation is the service user. They are the leader in their life, and we need to listen to them as social workers. And I think from this conversation, I'm taking away the spectrum of social work. We can be a political leader. You can be on the ground as a counselor. You can be working with people with domestic violence, with people with disabilities. You can be working in child protection, abuse systems. You can be working with mental health, learning disabilities, or refugees. So it is wonderful to see the spectrum of social workers and the opportunities to lead in those places as experts. But the most important voice within that is the people that we are serving. And I think from this conversation, I'm very much enriched. I know we have to announce the next webinars, which is very exciting. I think we will do, next week we are holding a Francophone speaking countries. So we've got some of the participants from Senegal, Burundi, and so if you speak French and you're a social worker, just be encouraged that that's coming. And I know that Noel is very keen to have a Portuguese speaking webinar too. So if you're from Angola or Mozambique, please get in touch with us. And I will leave the last words to the Vice President, Joachim. So if Joachim, you can close the session, and thank you.
Okay, yeah, so just a reminder that also that we are having our International Federation of Social Workers Global Conference, which is going to be online. And that will be from the 15th to 19th of July, 2020. And also we are going to have the general meeting for the International Federation of Social Workers. And it will be starting on the 11th to 13th of July, 2020. It's also going to be online. So for more information, you can visit our website for IFSW, which is www.ifsw.org. You'll get a lot of information from there. So just to appreciate the speakers of today, we are grateful that you accepted to be part and parcel of our webinar. Honorable Minister, thank you so much. You know, in Africa, there's a lot of protocol when you have to reach government officials or ministers. But I'm happy that you did not, we had to break the protocol, and you really were kind to us in terms of accepting to, you know, be part of the panel. We appreciate you, Rory, for accepting to join us in Africa, and also participating in telling our stories in Africa. My President Noel. And I would also want to appreciate Lola for the support you've been giving us throughout the webinar, and also even as we are preparing for these conversations. And I know that there are people in the background that viewers may not have seen. Nigel Hall and Godfred, they've also been in the background providing us with support. Last but not the least, I would love to appreciate the International Federation of Social Workers Global through the Secretary General and the President, Silvana Martinez, I think for the support also coming from IFSW Global, as well as Children and Families International Foundation. Thank you so much for your continued support. And viewers and followers, we appreciate you for being with us. And see you in our next webinar. Those that speak French, or even if you don't speak French, you're invited you know, to participate. And thank you so much. Maybe now you have one little thing to say as we conclude.
Just to say thank you very much. We will have an English version in 2 weeks' time, and I hope you would talk about it. Maybe let me push you to talk about it.
Yes, so we in 2 weeks' time we'll have another webinar which will be English because the English ones will be done every fortnightly. So we'll be having the English one, and the focused instance, is this the indigenous one, or the one we're dealing with gender? Women? Yeah, so the next that we'll be having in 2 weeks' time will be dealing with women and their role and responding to COVID-19. So thank you so much, and looking forward to seeing you then. Bye-bye.
Bye.